We're tertiary care clinics funded by Veterans Affairs Canada to provide interdisciplinary, specialized mental health treatment to veterans, members of the Canadian Armed Forces, and current and former members of the Royal Canadian Mounted Police.
Some office space.
So an operational stress injury can be any type of psychological difficulty, mental health difficulty that really stems from service and is kind of specific to the type of work that military and police do. We have some of our patients who come here who will see a psychiatrist, a psychologist, and an occupational therapist. And really it's us being able to kind of walk down the hall and talk to each other.
So this is often where we'll have most of our kind of group treatments.
They're all either active or retired service members, so they have a lot in common. It tends to be a really safe space that they can kind of come and really have a lot of their experiences validated and normalized and kind of hear somebody else having had similar experiences.
You're wearing a uniform and you're going to be asked, you signed the dotted line and asked that you are going to serve your country. So when you're faced with situations like that, when you come back home, and your family is going to notice a huge change in you. And if the individual notices that change, they should seek assistance. But the pride that they have will prevent them from doing that, like it prevented me from coming forward. And I thought I could handle it all, to the very last minute. I was doing pretty good. I mean, probably 51 years of it. And the last 2 years were very, very difficult.
Prior, if we go back 20 years, so many members, they suffer in silence and they just don't have access to treatment. They've given so much for their country and for us. We want to do everything we can to provide support for them for what they've given to us.
My hope is that everyone who walks in here, we can change their life for the better. Being able to kind of be patient and compassionate and sit in a room with someone, and sometimes, they floodgates open the second they walk in, and other times it takes months just to build that relationship with them to make them kind of feel comfortable to trust you.
Everybody here brings a genuine care for our population, and I think that's really, really important. And the expertise in wanting to help with everything that we do.
During my time working with the clinic, I'm very happy to say that I unloaded it all. And believe me, I did. I feel much better today than I have in many years.